Ezekiel Emanuel is here, who helped design the original Obamacare program. Dr. Ezekiel, thanks very much for joining us again. Good to see you, sir.
Lovely to be here.
How are you going to keep people like the UnitedHealthcare company, how are you going to keep them in the system? Because you've got to have them. Are you going to consider giving them government money, subsidizing them?
So first of all, you're absolutely right. We have to have insurers. They have to offer products for the exchanges to be viable. Second, we need to put United in context. United was very tepid about joining the exchanges early on, did very little, has never been a very active player. Even at its absolute peak, the largest insurer in the country, as you mentioned, had 6% of the exchange market. It's never been a big player, and it is not completely exiting the exchanges. We still don't know how many it's going to leave. It's said 5 so far, but it's been in 34 states, so it may well stay in most of the states it's been in.
You're sounding a little defensive. You're sounding a little defensive here.
I disagree with you.
Obamacare's in trouble with his insurers thinking about leaving. I think, you'll acknowledge that you've got a problem here, won't you?
Look, last year, you guys highlighted 39 insurers are leaving marketplaces. Turns out 40 were joining, but you didn't advertise that. The fact is, net last year for 2016, we actually had an increase in the insurers. And again, you're focusing on United, but you're not focusing on others. I do agree with you on one important point, which is the exchanges have had an increase or have had more people who are at higher risk using more health care services than we anticipated. That does suggest there was a lot of latent, unmet medical needs among poor people.
I mean, you need to keep the UnitedHealthcares of this world in. What do you do? I mean, is it a government subsidy?
I think that there are 3 important things that need to be done. The first is you have to attract more healthy people to get into the exchanges, and that involves making sure that the website keeps improving and gets substantially better. Second of all, you have to continue to educate the public. Still, many people, they read these high increases and they don't realize that net for 2016, after most of them got their subsidies, actually premiums went down for them, not up. And so I think there's still a big educational push that we need to make. And the third thing is, I do think, and I've always advocated this, because of the uncertainties of the market, it still hasn't settled down. We do need reinsurance and risk corridors, and I think those are important things. Okay. You label them subsidies. I don't label them subsidies. I think they're good business practices in an uncertain market where we're still not sure who's going to participate.
You're not
That's not a subsidy.
Doctor, you are not as chesty as you were last time you were on the show.
Oh, I'm very chesty.
You had a go at me last time. Well, listen to this.
We were in the same studio, Stuart. I could see the whites of your eyes.
Yeah, that's true. Yes. Never shoot until you can see the whites of their eyes. Remember that one? Right. Look, mid-level silver Obamacare plans. The premium increase is 11% this year, more next year probably.
No, wait a minute. Stuart, you are not telling the truth.
Thousands of dollars a year. And this,
Stuart, now you're trying to throw out red meat to me by not telling the truth.
You know it. It's not going well, and you know it. Come on. Where's an admission that maybe we should have done this or that?
Stuart, the fact of the matter is that for 2016, which is the only time we have premium data, the premium level went down in 12 states. The average after the subsidy premium was actually down, not up across the country. So your idea that this is falling apart is simply wrong.
Simply wrong. Okay.
Yes. I mean, I agree with you. We do need to attract insurers. We need to keep them in. We need to attract more healthy people to participate and get health insurance.
How many people come to me
we need to provide reinsurance and risk corridors.
You have no idea how many people come to us and say, these deductibles, they're killing me. It's not insurance. It's just I'm paying through the nose. You have no idea how many people come to me and complain. 80% of the people in these exchanges are getting a subsidy. I'm paying for them. It goes on and on and on.
Stuart, let me give you a suggestion. When you get your insurance, Stuart, when you get your insurance through Fox, all your coworkers are paying a subsidy for you too, And that is the way insurance works. Insurance works by everyone pooling their resources, and whoever needs it, needs it. We do it for Medicare. Again, most people who've paid into Medicare have not paid in the amount that they're actually going to take out. We do it in lots of other ways. Health insurance is a way that we spread the risk across everyone. That's its purpose. That's what we want. So when people need health care, they don't have a financial barrier.
Okay.
And the Obamacare is working very well to that goal. The second point I would make is that
hard break, Doctor.
Health care costs going up.
We have to do commercials so we can pay my vast wages, you know. And I'll show you the whites of my eyes.
I have been advocating to control health care costs precisely to keep premiums down. That is the key.
Okay. Okay.